everybody. It's Deirdre Vervo. Welcome to Let's Talk Seniors, Memory Care Issues, Alzheimer's, Dementia, and Parkinson's. Tonight, we have a special guest on, Anne McGuire, who's going to be talking to us about a pretty complicated subject, but she makes it simple. If you are ever concerned or confused about your health care, especially as you're getting older, what is the best health care for you? What kind of benefits does your health care offer? Do you have long-term care and are not sure exactly how to use that? If you could use it for in-home benefits, assisted living. If you are confused by it, you're not alone. It is a pretty complicated subject, and Anne has boiled it down and figured it all out, and she is here to help. So I'll tell you a little bit about Anne. She's a registered nurse and certified case manager and the founder of Healthcare Pathfinder. So for 20 years, she's been providing advice, advocacy, and management services to individuals, employees, and companies. She has a broad multidisciplinary professional background, including intensive care nurse, home care case manager, and supervisor. She's managed Medicare case manager, utilization review nurse, and a healthcare appeals and negotiation advocate. Currently, she's a member of many organizations, including the Case Management Society of America, Aging Life Care Association, as an advanced professional, Alliance of Professional Healthcare Advocates, at Home in Darien Board of Trustees. She's a former president, and she also resides in Darien with her husband and 2 adult children. So without much further ado, we will introduce Anne to the stage. Hi, Anne. How are you?
I'm great. Deirdre, thanks for having me and inviting me here today.
Well, you certainly have a lot of accomplishments going on here, and I know that people are often confused about especially long-term care and what the benefits are. And I think you can easily use them up by mistake or think that, you can't use them when you need them. So why don't you first tell us how you got into the business, Anne, and what it's all about?
Well, after, as you read, my years of clinical experience, I ended up working for an insurance company as a case manager and really enjoyed being able to help individuals. I worked for medical groups and helping patients go through the healthcare system and help them understand their benefits and really, work with them to get the care they needed and, support them. And when I moved, I worked for a startup that was really healthcare advocacy and helping people manage their health insurance and getting advocacy for their health insurance benefits. So really ended up specializing on the insurance side of helping people find it, understand it, manage it, and advocate for their benefits.
It's quite a unique specialty. And you're the first person I've heard of that does this.
Right. So, a lot of people just aren't as interested in the insurance side. I guess I'm a little bit of a geek when it comes to understanding the insurance. Yeah.
So what is the biggest question people ask you? What's the main issue that comes up over and over?
Well, it's really just the frustration of not understanding, when they end up in a situation in the hospital and understanding what's covered, why they can't go to a rehab or a skilled facility, and all the home care benefits. Everything's really depends on your own insurance. Every insurance is different. So it's really, that's what people come for, individual support and assistance in helping them really navigate their coverage.
For my own mother-in-law, I remember that when she was in the hospital, we can only have visiting nurses if she were there for a certain amount of time. If she did, it was pretty complicated. And also they didn't want to, They didn't want to consider her admitted. And I'm like, what do you mean she's not admitted?
Yeah, under observation.
And they're like, she's not admitted. And then I come to find out that's kind of like some tricky insurance term they use. Can you explain some of these things that lay people need to understand?
Well, it's the difference with observation. It depends on your insurance and how much it pays. If you're in the hospital, you go into the hospital emergency room and they observe you. So it's observation. If you're not admitted, then you don't qualify. You have to have 3 nights in a hospital, overnight stays, to qualify for insurance Medicare to pay for you to go to a skilled nursing facility. So if they only admit you under observation for a day or two, and it doesn't roll into that 3rd day overnight stay, Medicare doesn't pay for you to go to that nursing home facility, I should say, skilled nursing facility. So, and then it also applies to your different deductibles. So you have an out of network, you have a outpatient deductible, and you have an inpatient deductible. So your costs vary and your insurance may not pay for you to be in under observation. It'll apply to a different deductible. So it's very surprising to people, especially if they have a Medicare Advantage plan or very high deductibles, because it applies to different copays and different co-insurances. And
so does the hospital try to keep you in there under observation because
Medicare pays differently, and they will, if they admit someone, Medicare may deny it. So it's up to the hospital to determine what the insurance will pay. So sometimes you really have to, from an advocacy side, you have to really come in and look at what's going on with the patient. Do they have a temperature? Are they going to discharge them home? Have they done the whole workup? And often the area which is the hardest is when someone comes in from a fall, they haven't broken anything, and it's just pain management. And then that's when they have to be discharged home, or they have to write a big check of probably at least $12,000 to a skilled nursing facility if they can't take someone home to be admitted for rehab and sort of pain management. So it's a tough situation.
So is there a number of days that a hospital can say you're under observation, and is there a rule about observation? Like if you go in and you're running a high fever, is that observation?
No, if you're running, well, they can have you under observation to a point where they will either roll you over into an admission, or you are under observation and you're going to be discharged within 2 days, 2 to 3 days. It really depends on the level of care, and there's all different sort of requirements as far as how they determine inpatient, outpatient. So you really have to just be asking the questions, and you have to make sure that if you are told that you are under observation, they can roll it back, but you really have to acknowledge it and understand what's involved with being admitted under observation. And talk to your doctor too. Definitely call your doctor.
Could you ask to be admitted instead of under observation? Can you be like, this is an admission?
You can always ask that, but again, it depends on the criteria for your admission.
All right, so let's say you're on Medicare and you're under observation for 2 days, and then you're admitted for 3 more nights. Then to leave, you get to go to a skilled nursing, like a rehab center?
Well, if you get admitted at that point, it'll roll back. So you don't have to stay for 3 more nights. It would roll back.
All right, so then if you leave there, they either send a visiting nurse to your home, for instance, or you go to a nursing home. Are those the choices, or a rehab?
Yeah, and it depends on your insurance and what you qualify for. It's really what your level of care is. So, if you've been admitted, and I had a patient recently who, it was just surprising. Medicare, he was a Medicare Advantage plan. It was in Florida, and horrible burns. And they were going to, he was 78 years old, had been, walking, completely independent. And they were just going to send him to a skilled nursing facility. And his daughter had called me, and I said, wait, after working in surgical trauma intensive care, I said, for a man to have been burned his legs to discharge him to a skilled nursing facility, he needs to be in a rehab facility. So within that day, they discharged him to the hospital rehab, although hours earlier they were going to a skilled nursing facility.
Is there a different price point? And how would an average person know they're not going to take care of them as well?
Well, because it's hospital level of care at acute rehab and in the skilled level, and you have to be able to participate in 3 hours or more of therapy to go to acute rehab or have a higher level medical intervention. And then you go to a skilled facility if it's less than 3 hours, and it's sort of someone who does not need aggressive care management or rehab.
Got it.
But in this case, this was someone who was high functioning, and burns are very serious, and you have wound care, et cetera, et cetera. So very intensive case.
And do this all over the U.S.?
Yes, I have clients all over.
Oh,
yeah.
So now I know Medicaid is different in every state. Is Medicare different in every state?
No, it's your coverage, whether you have Medicare Advantage or what type of Medicare. If you have straight Medicare, the supplement plan should not influence where you end up going on a discharge. But Medicare Advantage versus Medicare, definitely. And if you have Medicare and a retiree benefit, that can influence your discharge plan as well. I had a client, again, who was in Florida. He was under observation and then got admitted for one night, and they were discharging him to a skilled facility. Medicare wasn't going to pay, but his retiree benefits were going to do that, would pay.
So I was
on the phone with the billing department at the hospital, and they said, no. I said, yes. He has retiree benefits.
So there's a Medicare and a Medicare retiree benefit?
Yeah, that's if someone worked corporate and has a retiree benefit.
Oh, okay. And
so it's 2 insurances.
Wow. So it's complicated. Do you also work with Medicaid?
As far as Medicaid, I will get involved with Medicare, Medicaid. But that's usually where I will work with other case managers when it comes to getting more involved on a medical management side. But yes, I will work with people because it's a similar benefit. But again, it depends on what type of advocacy they need. But it's a straight across. If someone qualifies for a certain level of care, my advocacy really, it shouldn't matter based on the insurance, even if they're young and, have group coverage.
Now, let's talk about long-term care a bit, because I know you do a lot of that as well. And long-term care, again, there's a million long-term care type policies. And the older ones, I guess, pay out a lot more, or per day, or, and now they're a finite number typically, right? So talk a little bit about long-term care and what people need to know about that and how they can maximize their benefits there.
Okay, well, so the policies are all different, and it's so important to just even review your policy and ask for a new policy from your insurance company, because usually you have the one that you signed originally. So you have to ask to have them send you an updated policy so you know what your benefits are, the numbers, the dollar amount. Yes, and some of those old policies, they're unlimited. So the insurance company, you really have to kind of work hard to make sure that they approve you for your benefits. I have several new clients. It's interesting within the past year it's the children have signed on to help them manage the long-term care plans for their parents. So for them, it's getting an updated policy through the insurance company. It's sort of, and I say, if you have a policy, make sure your children know you have it and have the information so that they could call the insurance company. Sometimes they only have a page that they don't have any phone number, or they have an old broker's phone number. So it's important to have that information. But as far as just understanding your benefits, it's really, these benefits have so much more value than even just knowing that you have long-term care. You can negotiate, and it helps you to get into skilled facilities or assisted living facilities because they know it's guaranteed payment for a number of years when you qualify for those.
Wait,
coverage.
you can negotiate with the assisted living facilities, not the long-term care insurance.
No, the long-term care, facilities, assisted living facilities, if they know
they're going to get guaranteed payment. So
yes.
what kind of benefits do people often miss out on that they didn't realize because they think it's only good if they go somewhere long-term?
Well, the most important thing is if you have it and you qualify, don't save it. It's important to actually use those benefits. Unless, these sort of newer plans, the plans that you have now, it's sort of use it or lose it. So often people say, oh, I'm going to save it. I don't know how, if I'm going to need it later when I get sick. Well, when you are actually qualifying for those benefits, it's important to file a claim and initiate that claim and get approved for those benefits. You can delay them and use them over extended period of time. For example, say you have $300,000 benefit, that $300,000 could be used up over years, not just 3 years. So you can extend it. So often, you can get an aid 1 day a week, and it's still, will extend.
You're not saying like use it up and not have it. You're saying don't wait till you need it full time. Like you could do part time. You could have somebody come in twice a week and help you bathe and dress and do, that kind of stuff.
Exactly.
Okay.
Exactly. So important things that people need to look at is the elimination period. It's sort of like a deductible. So it's how long do you have to wait before the policy starts to pay? So that's called the elimination period. And it's often 100 days. But these old policies, I do have clients who they had no limit. It was no elimination period.
So paid immediately. That's 100 days after. So let's say you have a senior has a fall and they go to the rehab, whatever. Now they come out. They have to wait 100 days before they can.
Well, so once you come out of the hospital, when you are in a long-term care sort of type of scenario, either home or in a assisted living or in a skilled rehab, then it will that starts the counting days. So you can initiate a claim. That's when the 100 days start. So you could be in a skilled nursing facility rehab with Medicare paying, and that's applying towards your long-term care benefit. Elimination period.
So that's the elimination period, but you're not paying anything because Medicare is paying, for instance.
Exactly.
All right. So let's say you have a fall and then you have to go to rehab for how many weeks usually?
So say you go to skilled facility for a month. So that's 30 days that have applied to your elimination period. Then you get discharged home. Then hopefully Medicare will pay for some of your care at home. Not a lot though, usually. That's when if you have to start paying for private aids, you have to pay up until you reach that elimination period, that 100 days.
Okay.
Now, important on that is I had a client who had received care. It was a year later, and they hadn't submitted the claim. And we submitted it to the insurance company, and they miscounted the days. So we had submitted 160 days, but when they had reviewed and processed the claim, they sent out a letter saying, congratulations, you qualified for 95 days, but you did not meet your 100-day elimination period. They had miscounted by 60 days.
All right. So wait a minute. Okay.
So I'm jumping to.
So you could do a claim retroactively.
Yeah. Yes.
So you didn't have to put it in like a car accident. You didn't have to put it in the day you fell.
And it depends on your insurance company as to how many days after or months after the actual claims were or the service was being received. It depends. It's individual to each policy. So you have to make sure you understand what those benefits are.
So, and like in this case, I guess she thought she was going to be okay, or he, and they put a claim in much later, and they allowed them to do it retroactive.
Mm-hmm.
Okay.
Yeah.
Now, would it have behooved them? Let's say they didn't even think they were going to need it, but should they have put a claim in and then just not used it? Or does that use something up? Let's say they put a claim in just in case they needed it and they went a year and they didn't need it.
Well, if you put a claim in and you don't submit any, bills, invoices against the claim, then you don't have to renew. You actually have to have some sort of services that you're receiving for them to approve it. Okay. If you don't continue those services, your benefit, you may have to requalify for another elimination period. So once you reach that 100 days and you are eligible for those benefits, that's great. You get payment and reimbursement, and say a month later, you are better and you no longer need those services, and you go more than 6 months. That's depending on your policy may say you have to qualify for another 100-day elimination period.
I'm just thinking of somebody that, would qualify, but maybe they have a spouse at home or a child taking care of them, and then something happens to their spouse or the child can't do it anymore. That's kind of what I have in my head. Like somebody else can help them so they're not putting in their claim.
Right.
Does that become an issue?
Well, no, because then they can qualify for a claim, but they're not going to be able to, unfortunately, depending on the policy, but most policies do not allow qualified family to be the caregiver and reimburse for those services. So you have to actually have a licensed agency or provider to qualify for those benefits for the elimination period. So that's another very important thing that people need to do and understand their policies, is they need to know if the agency or the aides are certified, if they work for an agency, whether they reimburse for family. There's all the policies are very different. And so you really need to call the insurance agencies to find out.
And
the companies.
They pay the claimant, right? Not the agency.
Well, in that situation, you need to call the insurance company just to understand your benefits. But sometimes they do, agencies accept assignment, and the policies can pay, the insurance company can pay the agency directly. But in that case, it's very important to be tracking those claims and make sure that you're getting the coverage that you paid for, because often you get billed for extra money from the agencies. And sometimes the agency hasn't been fully reimbursed by the insurance company. So I've had that on multiple situations where the billing has been incorrect from the home care agencies, and the patient client has been balance billed for $40,000+, realizing that it was just not being billed appropriately from the facility or the home care agency.
Wow.
So very important. It's not one thing to be approved and the claim to start to pay. It's another thing to make sure you're getting paid for, reimbursed appropriately, and tracking those claims.
That's really a lot of money to be in the gray area. So I could see why people need your service. Nobody wants to get a surprise $40,000 bill or realize they were overpaying what they thought they were going to pay. That's crazy. But
it's an area that I really had never, I came upon it several years ago and realized that it's just the way agencies track their aides. And it's just a whole Pandora's box that opened up. And I realized the importance of really managing the long-term care insurance benefits.
So when you take on a client, and how do most clients come to you, Ann?
A lot of clients are word of mouth through lawyers, financial advisors, through the associations that I'm a member of, the Aging Life Care Association and the Case Management Association and the National Advocacy Association. They all have provider lists where they can search for case managers in the area or advocates in the area, and also just through the internet, through my website.
But is it typically like, oh my God, we got this huge bill and we didn't expect it, or we need some help and we don't know what the insurance covers?
It's a combination of all those things. It's mom is in the hospital and they're saying she needs to be discharged, and we don't know where she should go. She's not ready to go. There's no discharge plan in place, and I can come in and talk to the team and the case managers and help to develop a plan, and if need be, appeal a claim, a denial to the insurance company. It's often that's when people contact me. There's something related to coverage that is an issue.
I have to tell you, having a home just like home with just 6 people with seniors now, the biggest thing is, how do you pay for it? So most people don't have an endless stream of money, right? They have their Social Security, their pension, and they might have long-term care insurance or other insurance, and they want to know, how are we paying for this and how long is that going to last? And then what do we do after? So knowing your long-term care benefits, and it's kind of a misnomer now because I think a lot of people think they're going to be on for good. And I have had people come to me that long-term care benefits good for like 2 years. How's that long-term care? That's short. Right. That's short-term care.
Exactly.
People are living to be in their 90s. And, if you need this benefit in your late 80s, it's pretty expensive to pay for something that's not going to last that long. So are there tricks in stretching that?
Well, again, it's understanding the benefits. It's really understanding and talking to your support in the community. Your financial advisors are really important, especially if you're young and you're, planning for the future. But it's really having people in the community, whether it be, hiring someone like me, or there's a lot of senior residential specialists out there who really can help you plan to go to the right place. Because often people will choose to go to maybe an assisted living that is much more expensive that they can afford long term. And there's other options out there. But home can be more, it depends on where you go. The home, you've got a ratio, which is of care providers to the number of people who are there, where having someone come into your home, just one person, is a lot more expensive than going and living in a community. So you really have to look at all the options.
Yeah, oftentimes people think that's not going to be as expensive, but you're also still paying for your house and your mortgage and your insurance and your food and your everything. And the caregivers, yeah. Wow.
Right.
It's a lot.
In the Connecticut area, it's about $700 plus a day to have a 24-hour caregiver come in to your home.
Wow.
Yeah.
So that's a nurse?
24/7. No, that's an aide.
That's a lot.
Yeah.
And you also help this is not just seniors, you help kids. And so would you say your younger set would be about maybe cancer or things that are more longer term illnesses? Is that what you're dealing with?
It's a combination. I've got clients with ALS and Parkinson's, but I also have families that are just overwhelmed. They go to a lot of doctors who are out of network or who don't accept insurance. So we submit and manage their claims. And, just help them track their coverage and help them find in-network providers. Some of these clients are going all over the country. So it's really helping them make sure that they are managing it and not just writing checks before they understand what is covered properly and the claims have been processed properly.
And Anne, do you stay with them? Like you were talking about, a facility might charge them for things that they shouldn't have to pay for or whatever. Do you manage that, or they come to you after and say, I think I'm mischarged? Are you looking at those bills every month?
Oh yeah, we do it ongoing. We've got clients who are ongoing retainer clients, have been with us for years and manage their, they get a bill, they send it to us and we track it through their claims online and uh, manage their health savings accounts and retirement reimbursement accounts. So we will do the full sort of spectrum of care, which is really nice, having a sort of the ability to be really collaborative with them, but from a holistic approach.
You know, I have a very ill cousin, and she's younger than me, and she pays almost $2,000 a month for health insurance because she has all these illnesses, and she also has a high deductible. And I'm going to send her to. I'm like, that seems outrageous, but you know, she needs to make sure everything's covered. So it's a lot when you're sick.
It is. At least, though, prior to 2010, you couldn't necessarily get insurance if you were not working, and depending on what state you lived in, you may have to move to another state where you could actually qualify for coverage. So at least now people have access.
So what is the inside scoop on the best state you should retire to if you're for health coverage?
Well, that's changed. I mean, gosh, prior to 2010, Arizona was the state that you had to move from. Basically it was go to Massachusetts because you could get access to any type of coverage, or California. So now it's really things, who knows what will happen over the next couple of years. But for example, we're based in Connecticut. Connecticut, you cannot, if you're healthy, you only really have access, and you're an individual who doesn't have group coverage, you only have access to sort of Connecticut health insurance based marketplace or off market. It's sort of confusing, but you cannot get a plan that has pre-existing condition exclusions. So it's other states, you can sort of go off the market, and if you're healthy, you can buy a separate plan. But the goal in, say, Connecticut, and the goal for the Affordable Care Act, the Obamacare, was that we try to get as many healthy people into the system so it will decrease the cost of the insurance. So I think that's the ultimate goal going forward, but we'll see. We'll see, because it's hard, because people who have these rich corporate benefits, they have just, when they don't lose those benefits, it's just such a new reality of what everyone else out there is experiencing, where you don't have lower deductibles and you have restricted networks, and you don't have as much choice.
And do you also have people with their HSA plans?
Yes. Yeah. Their health savings accounts, and their, if they have flexible savings accounts through their employers, or both, or retirement reimbursement accounts. There's just all different types of reimbursement accounts out there.
Those are complicated. You really have to know a lot about everything, Anne.
Well, those are just sort of like another bank account. It's just, but again, it's just another sort of.
But you have to know Medicaid, Medicare, HSAs, all the different state requirements, all the long-term care policies. You must love paperwork. You must be like a lawyer. You have to read everybody's policy and figure out what you could do. And then do you spend a lot of time arguing with the agencies, to hand over benefits?
Well, it's really the appeal, and which, again, that's what we love being proactive with clients and being able to help advise them from the front. And I've got my team who works with me, the same background, all have backgrounds in health insurance. And so it's really, the appeals, yes. And just even getting the right information when you call up the insurance company, right? How long you can wait on the phone, and you get the customer service representative who answers your question, but we know it's not right. So we always ask for a supervisor or a manager.
You have to keep calling until you get the right answer.
Yes, exactly.
Yeah. Right. And it's pretty tricky just for an individual. I mean, last year I spent a lot of time on the phone, and I barely go to a doctor, but everything was put through like some healthcare system that wasn't on my plan. But how did I know they were sending my blood work there?
Right.
go to whatever it was, Stanford Hospital. I went to my doctor and he said my blood work somewhere that wasn't covered by my insurance. Same thing with x-rays. And I'm like, how am I supposed to know that? You're the doctor sending it. Shouldn't you know my insurance? They're like, no, you have to know your own insurance. So you really have to know your own insurance. Ask the doctor if they're sending your blood work or your x-rays. Where are you sending those? Okay, you can't send them there. You have to send them here. It's so good to know.
It's in one area right now that I find really difficult, and especially for seniors on Medicare, is the prescription drug coverage. It's these plans change, the formularies change, and every year they have the option to change their plans. And when they do change, it's confusing because there's a deductible and then there's tiers, and it's, you really appreciate it when I work with, I've worked with several clients during open enrollment period, and it's amazing what people do and how detailed they have to get in understanding their prescriptions and what it's covered under and why it's, not covered at a different level, and getting authorization for a medication that they have to have because they had a reaction to another one. It's very confusing.
I was doing something for my mother-in-law a few years ago, and there was like some donut time, like
donut hole, yeah,
like a month that you couldn't get your medicine or something crazy. I was like, what is that? What is a donut where you can't get your medicine? Like, how does that
it's a deductible in the middle, and it's just your prices go up, and the share, how the insurance pays and how you pay changes.
Do they still have that?
Yes.
Okay. I just thought, what is going on there? That seemed absurd.
But I have to say, prior to 2006, Medicare, they didn't have drug coverage for seniors. So it's, people were literally, they still are today, but there was no prescription drug coverage for seniors.
Wow.
So people have to be reminded that at least there is coverage now.
But you know what I find a little criminal, Anne? We've paid into Medicare for 40, 50 years before we use it. And then A, it costs us money. And B, everybody doesn't have the same care.
Right. Yeah.
But
everyone's trying to shop and get the different plans that are, less expensive, but then, but that's and the Medicare Advantage plans can be great, and it depends on where you live in the country but in the Connecticut Fairfield County area, a lot of physicians don't participate in those plans, but it's also the skilled facilities, there's networks. So, there could be, all these facilities that accept Medicare, but if you're on a certain Medicare Advantage plan, that facility might not be a network. And that's often where the children with their parents end up in the hospital, and their choices of where they can go are limited. And it's often because they're on a Medicare Advantage plan. So that's where people get surprised. So it's important to know what Medicare plan your parents are on, if there's anyone out there with, older parents.
Yeah, but it's also kind of crazy when you're in need to be like, hold it, wait a minute, let me make some calls to see what's happening here. It's like, yeah. But so I could definitely see why people turn to your service, Anne. So I think it's an unbelievable service. I'm just so happy it exists. I haven't heard of it, and I know people that have a lot of issues with their health insurance. So I think it is a wonderful service, and I applaud you for, well, I'm not sure you came up with it, but creating a business around it for us in Connecticut and beyond.
Well, I love to be a resource too, and really help people, because there's definitely other support. People pay for my services, but there's other services out there that, if I'm not the right fit for someone, I would love to be able to be a resource and see if I can send them in a direction where they can get help.
Very, very sweet. So if somebody's having a major health crisis, cancer, whatever, something new, is that the time to come to you?
Yeah, actually, that's the perfect time, is because so often when they get a new diagnosis, people just start going to all different places and getting care all over the place. And I completely understand that, but it's sometimes helpful to really think about the long term and understanding, what your insurance is going to pay and who's in network, and see if you can work from that angle and not start writing checks right and left.
No, it's very great advice, because at first you don't write checks right and left. You go to the doctor and 2 months later you're getting surprise bills. That's more like what's happening, right? You're not sure what's happening. So,
right.
Yeah. But
right. And doctors and facilities, they sometimes are willing to work with you. So people often don't like to negotiate when you're getting the care, but it's okay to call the billing department and ask questions.
I have done that with Stanford Hospital, for instance, and they've always reduced the bill.
Yeah.
Just by calling.
Right.
I'll be like, wow, this is kind of an astronomical blood test.
Yeah.
They'll be like, all right, we'll take off a percentage. I'm like, okay, thanks. I'll pay it.
Right.
So yeah, I guess they expect people to do that so you could call and negotiate.
Right.
Thank you so much, Anne. I really love your service. Healthcare Pathfinder is the name of the company, and you service the entire U.S., even though you're based right here in Connecticut. And your number is 203-656-2167. And as Anne just shared with you, not just insurance, but she knows a lot about where to point you in the right direction if it's not just insurance. And you have other questions, so feel free to give her a call. And is there anything you'd like to say in closing words, Anne?
Well, just thank you very much. And as I said, with the new year starting, I always say just really try to check out your benefits and also make sure you have a backup system for paying your premium, just so you don't lose your coverage by mistake.
What do you mean about
paying premiums?
For
paying premiums, for paying your premiums.
I thought you meant the deductible. Oh, so make sure you pay your premium so you don't lose your health insurance.
Yes, yeah.
Because when you lose your health insurance now, it's really hard to get back on, isn't it?
Well, if you go beyond it, start to get it reinstated is really difficult. And especially if you are on COBRA, if you miss a payment, the chances of you getting it reinstated are very slim.
Wow.
So have backup plans for your long-term care and your health. There's documents you can have filled out that you can designate someone to receive notification if your policy is canceling. Very important.
Good advice. Well, thank you so much, Anne. Hopefully you'll come on again.
I'd love to.
It was great having you. And since we're neighbors, I'll probably see you around town. And
great.
Thank you so much. I appreciate it. Thank you, Anne.
Thank you. Bye-bye.
Wow, that's Anne McGuire, 203-656-2167. You know, what I'm learning in this field now is that there are so many people you can reach out to. So many times I hear people just so lost and confused over what to do, especially with their parents, because it's, the first time they're dealing with anything and they don't know where to turn, whether it's health insurance or financial insurance or how to save their house or their assets. There are so many resources for elder care. And Anne is a very good example of that. And insurance can be so tricky. And, I know myself, and I've not had any major anything, and I've gotten so many surprise bills. So if you are facing any kind of new diagnosis or life crises, it's a great idea to just start immediately with Anne instead of a doctor telling you to go to these 9 places and figure things out. You don't want to be ill and then also experience, financial trauma after that. So thank you so much, Anne, for that. Well, until next week, I really thank you all for joining us. And I always look forward to learning all about everything that everybody has to offer. So until next week.
Hi, Deirdre here again. Thank you for joining me on Let's Talk Seniors Memory Care Issues. Is this an issue hitting home? Do you have a parent or loved one with memory care issues who you feel is not safe at home anymore? Are isolation, falls, and safety issues becoming a big concern? Welcome to Dogwood Senior Home, premier boutique residential senior living specializing in memory care. It's country living at its best in the Huntington section of Shelton, Connecticut. We're truly a home with only 6 senior residents living as one family unit. Senior residential homes are concepts sweeping the nation with 47,000 across the U.S. We're pleased to open Dogwood Senior Home as it will be only number 6 for Connecticut. Brand new, sparkling clean, opening mid-June. And safe, safe, safe. We are COVID-free. Residential care homes boast a very low COVID infection rate across the nation. This is due to the intimacy of size and speed in which the caretakers can shift to accommodate immediate needs. They are much safer than the large homes and facilities, as you can imagine. It has been documented that residents have less falls and a better quality of life in a residential home environment. Our home is more affordable than the big box facility. You pay one all-inclusive price, and that price is guaranteed for the life of the resident. With an incredible 1-to-3 caregiver ratio, which you won't find anywhere else. Our friendly, loving caregivers are dedicated and trained in Alzheimer's, dementia, and Parkinson's issues. We're only taking 6 residents, so the home will fill up fast. Call me at 203-689-7562 for a talk and tour. I would love to meet you and your loved one. See you soon. Bye.